the role of nutrition in preventing hospitalization and nursing home stays. My name is Jenny Kinter, and I am an Associate Marketing Manager at General Mills and will be your host for the webinar today. This webinar is sponsored by General Mills Foodservice, providing the food people love away from home. We are so proud to offer the quality products food service professionals rely on for consistent results in their own operations, as well as the beloved brands their customers know and trust. Today's webinar is supported by General Mills Bell Institute of Health and Nutrition. The Bell Institute is the company's internal source for scientific health and nutrition expertise. Before we begin today's program, I'd like to cover a few housekeeping reminders. Today's webinar will be recorded with a Q&A session at the end. However, you may submit questions at any time during the webinar by clicking the Q&A icon in the upper right-hand corner of your screen. After the webinar concludes, you will receive an email with links to the slides, as well as continuing education credit certificates in the coming days. Please note, approval by the Commission on Dietetic Registration for CEUs was not requested for this webinar. With that, it is my pleasure to introduce today's experts. Since joining the Chefs of the Mills in 2006, Chef Sonia Kerr has focused on troubleshooting recipes and product performance, reverse engineering products, developing and standardizing recipes, mapping flavor combinations, maximizing ingredients, and menu engineering. These skills help Chef lead product knowledge workshops and training sessions for General Mills Foodservice's internal and external partners. Chef Sonia built more than 25 years of previous food service experience working in restaurants, bakeries, colleges and universities, hospitals and healthcare, and catering organizations. Additionally, Chef has earned certifications including Executive Chef, Sous Chef, Dietary Manager, and Food Protection Professional. A dedicated learner, Chef Sonia has an associate degree in culinary arts from the University of Toledo and a bachelor's degree in culinary management from the Art Institutes International of Minnesota. She has also completed the Cook's Apprenticeship with the American Culinary Federation. Our clinical speaker is Katie Dodd, MS, RDN, CSG, LD, FAND, and owner of Katie Dodd Nutrition LLC. Katie is a geriatric dietitian, writer, speaker, consultant, mentor, and leader. She is a board-certified specialist on gerontological nutrition and fellow of the Academy of Nutrition and Dietetics. She spent 13 years working as a home care dietitian for the VA before diving into entrepreneurship full-time. Katie is the owner of Katie Dodd Nutrition LLC, founder of the Geriatric Dietitian blog and High Calorie Recipes food blog. She's also the host of Dietitian Side Hustle podcast. Learn more about Katie at thegeriatricdietitian.com. We are so pleased to have her. Thank you so much for joining us today, Chef and Katie. With that, let's begin our presentation. I hope you all enjoy. Katie, feel free to come off mute and get started.
Wonderful. Well, thank you so much, Jenny. I am so excited to be here today speaking to so many of you about a topic that I am incredibly passionate about, and it is aging in place, the role of nutrition in preventing hospitalization in nursing home stays. Now, when we take a minute to think about what we want life to look like when we're older, thinking about those golden years, we have this vision of, I'm going to retire from work. I'm going to be doing these things that I love at home, maybe surrounded by family, maybe gardening. We all have a different vision, but these are the golden years. What we don't anticipate the golden years will look like is being in and out of hospitals, being in a nursing home where we're constantly dependent on someone for care. So when we think of the golden years, we envision having independence. We envision being able to live out our final years doing what we love. And this is why I love being a geriatric dietitian. This is why I love giving talks like this one, because nutrition, along with many other important things, plays such a pivotal role in helping aging adults make the most of the years that they have left, make the most of their golden years. So I'm so excited to have you all here today as we talk about aging in place. So what are we actually going to cover today? Well, actually, before I jump into that, I did want to break down my certifications because I have more letters after my name than in my name. And I know I'm speaking food service operators. And I just want to make sure everyone understands what all these little credentials mean before we dive all in. So that MS just stands for a Master of Science in Food and Nutrition. The RDN stands for Registered Dietitian Nutritionist. The CSG is that board certified specialist in gerontological nutrition, which just means I took an exam, have a certification that I keep up every 5 years to really keep me in the know with geriatric nutrition. The LD simply means that I am licensed in the state of Oregon, where I live. And the FAND is the Fellow of the Academy of Nutrition and Dietetics, which in a nutshell just means I volunteer a lot in the field. So I know Jenny shared that I have a website where I love sharing nutrition information with the public about older adults, and I do live in Southern Oregon. So our objectives. My hope is that by the time we are done with this webinar, you should be able to do three things. Be able to understand the changing nutrition needs with aging, be able to recognize the benefits of maintaining a healthy lifestyle during hospitalization and rehab and post-discharge when they go home, be able to describe how nutrition can be used to prevent future hospitalizations and health complications. So looking at our agenda, what I will be covering today, we're really breaking this down into three big chunks. First off, we're going to take a lot of time to lay the foundation on the changes of nutrition and health with aging. We're going to dive into some sciencey things, talking about this physiology of aging. We're going to talk about health changes and nutrition needs and other issues. And then we're going to dive into maintaining a healthy lifestyle during rehab and hospitalization, but then also when home. And then we're going to talk about the important role of nutrition and especially protein. Then we have a wonderful video or training for you with some recipes that Chef Sonia is going to share. And then we are going to wrap things up with plenty of time for Q&A. So let's talk about changing nutrition needs. We know that throughout life, nutrition needs change. I have a little image on here, and we see someone going from a baby to a toddler to a child to a young adult to someone in the prime of their life. This is a woman, so maybe they're entering menopause and then old age. We know that in every stage of life, things are going on in the body that make our nutrition and health needs different. And I think this is really important to discuss because so often when we talk about nutrition, we talk about nutrition for adults in general in the prime of their life without recognizing that there are changes going on inside the bodies of older adults, which means changes in their nutrition needs. So we're going to dive into the physiology of aging and what the different nutrition needs look like specifically in the older adult. So this slide I really love. It's kind of the anti-slide. It's everything a slide shouldn't be. It's busy. There's lots of words, not a lot of white space. There's a lot going on, but I think it also paints a good picture of the physiology of aging, meaning there's a lot going on in our bodies when we change. So what this slide is showing us is some of the changes that we might expect to see in an aging adult. So looking within the GI tract from the moment food goes in to the time food goes out, there are lots of different changes we see. First off, we see xerostomia. This is dry mouth. Our body produces less saliva, and that can impact all kinds of things related to swallowing, taste of food, enjoyment of eating. We also see more poor dentition, so difficulty with chewing foods. We see altered taste and smell. This isn't always complete loss of taste and smell. It's just maybe diminished taste, diminished smell, or even changes in the way foods taste or smell. And this could be with aging, but then also with medications that we know oftentimes older adults are on. We also see decreased esophageal refluxes, so we might see more GERD or heartburn. There's increased gallstone formation, decreased glucose formation, and insulin and beta cell production, which really just means that we see more rates of diabetes in aging adults. Decreased metabolic capacity of the liver, decreased hepatic drug clearance, which means changes in how the liver works and metabolizes things and drugs. And we also see more incontinence. So that's just within the GI tract. Looking at some other organs, we also see with aging decreased skin elasticity. This can lead to increased skin tears, more pressure injuries. We see higher rates of age-related macular degeneration and hearing loss. So this could look like, they're not able to see as well, not able to hear as much. And I'm going to dive into a couple of these in the coming slides, but we don't often think about how much our eyes have to do with eating. When we look at food, we see a delicious plate of food. We start salivating, we get hungry, we are ready to eat. And if we have low vision, if we have poor vision, it takes away that part of eating that we enjoy so much and honestly can make eating less enjoyable. So vision actually does play an important role in eating delicious food and getting that good nutrition. We also see thickening of the heart, decreased breathing capacity, so changes in like how the lungs work, decreased GFR and renal blood flow, that's just changes in the kidneys, decreased sensory perceptions, decreased cognition and memory. So we do see increased rates of dementia, Alzheimer's disease. We see loss of lean body mass. That's what LBM stands for. We're going to dive pretty deep into this one today. This means loss of muscle. And then we also see degeneration of the joints and decalcification of the bones. Oh, that is a lot going on. And I know this makes aging seem super exciting, right? Like, oh my gosh, that's all the stuff that happens. But I really want to enforce the power of living a healthy lifestyle. How you age matters, and it is never too late to change. But we need to understand that there are these changes going on inside the body that impact health, that impact nutrition needs. So we need to approach nutrition different for older adults than we do for younger adults. So diving a little bit deeper into some of those items on the slide, looking at some of those biological changes we see. I mentioned dry mouth, and dry mouth is important for so many reasons. It's related to dental health. We don't think about how that spit in our mouth helps keep things lubricated, moving around. It can help with, minimizing dental caries. It also helps with swallowing. Oftentimes when I have a client who has difficulty swallowing, I might have them have, soft, moist foods to help get the foods down. And impact taste. Having saliva in our mouth does impact the ability to taste. So if someone has dry mouth as a result of aging, or if they have dry mouth as a result of medications, then that can impact their ability to eat and get nutritious foods in their body. Now, I know I mentioned altered taste and smell, and because we know that this is happening, this is why flavor matters. This is why it's so important that we provide foods that have delicious flavors, spices, herbs, things that just make food enjoyable, especially if someone doesn't, foods don't taste as good as they used to, and they might have poor appetite. So we want to make sure that we're providing foods that entice people to eat so they get that good nutrition in their body. And then finally, with the biological changes, is that we just know that organs work differently as they age, and typically it is diminished function. So looking at some of those physical changes, I mentioned the decreased skin elasticity, and that means that there's increased risk for pressure injury, especially for clients who might be maybe bed bound, maybe wheelchair bound. They don't get up and move as much as they once used to, and they are at risk of getting pressure injuries at those, prominent bony points on their body. But then also more likely to have skin tears if they rub against something or fall onto something. They're more likely to have injury of their skin because they have less elasticity in it. Loss of muscle. This is sarcopenia. Again, we're going to dive into this, but it doesn't hurt for me to repeat this over and over to you with you guys. But sarcopenia is the loss of mass with age. It happens to all of us. It typically really kicks in around 40. It happens earlier than that. And I'll show you some slides later that kind of show when it happens. But it is the natural loss of muscle mass with age. This is one of the most important things that I always hone in on when it comes to aging is loss of muscle and sarcopenia. And I want you to take a minute to think this morning when you woke up. Your alarm went off, you got out of bed, you went, you got dressed, you brushed your teeth, you made breakfast. To do all of those things to be able to take care of yourself, you need muscle. You needed that muscle to get out of bed, to stand up, to walk, to put on your clothes, to make that meal, to brush your teeth. You need muscle to do all of these things. And if you don't have muscle, if you've lost too much muscle, then you are no longer able to be independent, to do the things that you need to do to age in place, to stay at home, and all of those things. So again, we're going to keep coming back to sarcopenia, but this really is the most important piece. We also see weaker bones, which does increase risk of fracture and increased fall risk. And if someone is losing muscle, they're a little less on balance. If they do fall because their bones are weaker, they're more likely to get a break, go to the hospital, recurrent admissions. So lots of physical changes that happen in aging. And finally, looking at some of these functional changes, we see changes related to mobility. Mobility is not quite what it used to be. We see more weakness typically because of that sarcopenia, and that does affect someone's ability to prepare meals. And a lot of people are in situations where meals are being provided to them, but they also have to be able to get down to meals. They also have to be able to eat independently. So weakness can impact the ability to eat food and get good nutrition. Coming back to the poor dentition, I want to take a minute to talk about dentures. Not all older adults have dentures. Tooth loss is not a normal part of healthy aging, but we do see a lot of people who have dentures. But I think it's important to remember that dentures are not an exact replacement for teeth. I don't have the stats on me, but we know the bite force of dentures is a lot less than the bite force of natural teeth. So even if someone has dentures, they might not be able to chew foods as well. as when they had natural teeth. And with dentures can come all sorts of problems. If food gets, under that ridge, it can cause a sore. The dentures might not fit very well. It could pain when they're eating. It might want them, they might want to avoid eating, or the dentures just might not work well. They don't want to wear them. And they might feel uncomfortable not wearing dentures because it does change the way our profile on our face looks. And it could lead to avoiding eating or meal times. And then also chewing difficulty. We know that dental care is very expensive. And so often, if someone can't afford dental care, they might opt for the option of, let's just pull that tooth out. I don't have the money to get that crown, to get that replaced, to get that cavity filled. Let's just pull it out. But what happens is when someone has lost a lot of teeth, it can make chewing more difficult. So we have this thing called occlusion, and it is where if you have a tooth on the bottom, a tooth on the top, we want to be able to bite down and have the two teeth that connect. But if you have a lot of teeth that are missing in your mouth, then you don't have that occlusion. You bite down and you don't have those two teeth that are connected that are needed to grind and eat food. So poor dentition, whether they have dentures or missing teeth, it can lead to difficulty chewing, making it harder to eat and get the nutrition their bodies need. And then finally, decreases in cognition and memory. This does impact dietary intake, and this can be from forgetting that they ate, being distracted during meal times. This is more specifically someone with dementia or Alzheimer's, and they just might not have that normal interest in eating that they used to, and that could impact their nutrition and, of course, their independence. So coming back to healthy aging, how you live affects how you age. Now, I am a dietitian. Of course, I'm talking about nutrition, but I would be remiss if I didn't talk about whole health and all the things that are important for healthy aging. So nutrition is so important, but so is hydration. We want to make sure that we are adequately hydrated. Our bodies are made up of a lot of water, and it is important. We also want to make sure that we are getting regular physical activity to keep our body strong. This includes, cardiovascular, getting that heart rate up, resistance training, working those muscles, but then also flexibility to help with balance. Making sure that you're getting enough sleep, because sleep is very important. Managing mental health and stress, and then making healthy lifestyle choices like smoking cessation, either sustaining from drinking or drinking within the recommended guidelines. And one thing that I want to enforce is that it's never too late to make a change. I know that we're talking about aging adults, and a lot of these might be for your clients, but you might be thinking of yourself like, oh, I need to start exercising a little bit more. Know that healthy aging matters. How you live affects how you age, and it is never too late to make these healthy lifestyle changes. So I want to talk about the changing nutrition needs with aging. So we set the stage of there's a lot of changes going on inside the body, that physiology of aging. Because of those changes, that changes how we look at nutrition for older adults. Nutrition needs change throughout the life cycle, and they are different for an older adult than someone in the prime of their life. So when we're looking at the key nutrients that someone needs to have a healthy, balanced diet, there's really 6 nutrients that change with older adults compared to younger adults. So I'm just going to kind of go over this high level, and later on we will be diving into protein. But these nutrients include protein. So older adults do need more protein. A little sneak peek, it's related to sarcopenia, it's related to muscle loss. We want to provide adequate protein to protect those muscles. Now, the next one, fiber. I'm going to say this with caution because technically fiber needs do decrease with aging. So what I mean by needs is there are these recommendations on how much of a nutrient someone should get based on their gender, based on their age. So technically speaking, the recommended dietary allowance for fiber is lower in older adults than younger adults. But here's the caveat here. 95% of adults don't get fiber. So even though older adults technically, according to the guidelines, need less fiber than younger adults, pretty much everyone needs more fiber. So I always say this with a little caveat. I know it says less, but most people actually need more because most people aren't getting the amount of fiber they need anyways. So technically they need less, but realistically, everyone needs to be eating more fruits, vegetables, whole grains. So next we have vitamin B12, and vitamin B12 is an interesting one because we know that in older adults, 10 to 30% of older adults can't absorb B12 through food sources. So it's actually recommended that older adults get half of their vitamin B12 either through fortified foods or through supplements. Next, we have vitamin B6, and this one is increased needs. We know that older adults need more B6. They also need more calcium and vitamin D, and these two nutrients are the big ones when it comes to bone health. We mentioned that before, increased risk of fracture and all those things. So older adults do need more calcium and vitamin D. So some other concerns that we do see when it comes to aging is malnutrition, unintended weight loss, and muscle loss. They're all interconnected, but I'm going to talk to you guys about them very separately because they're all important when it comes to maintaining independence. Like what I said at the very beginning of this presentation about the golden years and how we have this vision of what we want life to look like as we, draw closer to the end. And a big part of that is being independent. So malnutrition, malnutrition simply means that you are not getting the nutrition, the food, the nutrients that your body needs. Now, malnutrition can be a tricky one because we often think of malnutrition and we think of starving children in third world countries who are just skin and bones, but that's not a realistic representation of what malnutrition is. We know that up to 1 in 2 older adults are at risk for malnutrition. It is a big deal. They're not getting the nutrients they need. If they don't get the nutrients they need, this can lead to all kinds of health issues. Actually, I'll read that right here. Malnutrition can cause medical complications, increased fall risk, longer hospital stays, readmissions into hospitals, loss of independence, and even death. So preventing malnutrition is so important. We need to make sure that aging adults get the nutrition their bodies need and be mindful that malnutrition looks different in different people. Someone could be overweight or even morbidly obese, and they can be malnourished. And we have to be mindful not to look at someone and think, oh, they're fine. They've got plenty of stores, because that is not the case. They can be malnourished. And we know that, 1 in 2 older adults are at risk for malnutrition, and it can lead to all kinds of issues that are going to prevent them from aging in place, that are going to keep them in that loop of going to the hospital and going to rehab and all kinds of other things, including death. So I wanted to share this slide because I think it's important to understand how we as dietitians and healthcare professionals are diagnosing malnutrition, because we can't just simply look at as dietitians, we are trained in this, but for the most part, we don't just look at someone and say like, oh, you're getting enough nutrition or you're not. So this information here, it's coming from a consensus statement by the Academy of Nutrition and Dietetics and the American Society for Parenteral and Enteral Nutrition. And so as a dietitian, if I am going to diagnose adult malnutrition, I am looking at 6 different characteristics. If someone has 2 or more of these, then they have malnutrition. We need to start intervening to make sure that they get the nutrition their bodies need to stay healthy, to age in place. So these 6 characteristics that we're looking at include insufficient energy intake. Are they getting enough nutrition, enough food to meet their needs? Weight loss. Are they losing weight? Loss of muscle mass. So independent of weight loss, are they losing muscle? Loss of subcutaneous fat. Are they losing their fat stores? Localized or generalized fluid accumulation. And this is swelling or edema that we might see like in the extremities. And this is important because this can actually mask unintended weight loss. This can mask something like maybe a muscle loss because there's some fluid and you can't really tell that weight has been lost. And then also diminished hand grip strength. We know that people who have diminished hand grip strength are more likely to be malnourished. So if someone has 2 or more of these, they have malnutrition. So it's not just, okay, they're not eating enough and they've lost weight. It could look like, well, their weight's stable, but they've actually lost muscle. Their hand grip strength is too low. They've got some edema. So we look at the bigger picture when we are diagnosing malnutrition. So looking specifically at the unintended weight loss that was on that list, because it is so important. As a dietitian and as healthcare professionals, and probably at many facilities that you may be at, we monitor for unintended weight loss. So what is unintended weight loss? Unintended weight loss is simply an amount of weight that was lost over a period of time that we say like, hey, that's too much, that is concerning. And we're going to talk about it in the next slide. But one of the biggest issues with unintended weight loss is that it leads to muscle loss. Muscle loss is bad. We keep coming back to that. So unintended weight loss looks like a loss of 5% body weight in a 30-day period, or 7.5% body weight in a 90-day period, or 10% loss of body weight in a 180-day period. So oftentimes in facilities or at doctor appointments, people are weighed and they're looking for, okay, is someone losing weight? And they often get triggered at these different points. But I want to mention insidious weight loss because this is an important one. It can be pretty sneaky. And this is the gradual unintended weight loss over time. This means that someone hasn't lost weight suddenly. It's not super dramatic. It's not very noticeable, but we're noticing a 1 to 2 pound weight loss unintentionally every month. And it just continues and continues and continues. And so we want to be mindful that we're looking at the whole picture of a person and not just making sure we're checking boxes. Unintended weight loss is not a good thing because it leads to muscle loss. So here's the slide where, there's a couple where we're really talking about sarcopenia. And as I mentioned, sarcopenia is that decline of skeletal muscle tissue with age. So sarcopenia is a big deal. It is the major cause of functional decline and loss of independence in older adults. Now, this little picture that we're looking up here, this is actually like a cut of someone's leg. So this is like a little scan. And what we're looking at is that little circle, a white circle in the middle is bone. The kind of darker color is muscle, and then the white on the very outside is fat. So on the outside, these are two very similar shaped legs. If we were to look at someone on the outside, they would look like the same size of leg. But what we can't see is what's going on the inside. So on the left-hand side, we have someone who's 25 and they have lots of muscle in that leg. But then we have someone on the other side that is 63 and they've been experiencing sarcopenia. They have lost muscle and have more fat. So even on the outside, it may look like the same leg. We know that on the inside, it is very different. They've lost muscle. And remember all of those important things that we need muscle to do to be independent, to take care of ourselves, to maintain our health. So I like this slide here because this kind of paints the picture of sarcopenia. So, it typically really starts becoming significant around age 40. Yes, it is happening in our 30s, but from ages 40 to 70, we see an 8% loss of muscle mass per decade. After age 60, it's a 15% loss of muscle. So I hope everyone's taking note to go do their resistance exercise to help protect that muscle. But this is a normal part of aging and we need to be aware of it. So coming back to the unintended weight loss. Unintended weight loss is a big deal. When we lose weight unintentionally, we don't mean to, we're not doing anything to protect our muscle. We are losing muscle. Sarcopenia is already happening, right? That normal progression of muscle loss. But when we lose weight unintentionally, it accelerates it even faster and increases risk of so many different things. And I think for me, one of the reasons I'm so passionate about this is that we live in a world that is very much focused on weight and weight loss. When someone loses weight, people are like, congratulations. And I've seen far too often with older adults who have experienced unintended weight loss and have well-meaning people around them say, congratulations, you've lost weight. You didn't even try. That's amazing. And they might even feel proud of like, look at me. I'm losing weight. I'm getting back to what my weight used to be. But as the geriatric dietitian, I'm over here like, no, this is a big deal. They are losing muscle. Nutrition needs for older adults are different than nutrition needs for younger adults. And as we're losing muscle, that can lead to a whole host of issues on the slide. Bottom line, unintended weight loss leads to muscle loss, leads to loss of independence, increased fall risk, and risk of early death. We need to stop unintended weight loss in older adults and be very mindful of our conversations not to congratulate someone who is losing muscle and becoming at an increased risk for not being able to age in place. So let's talk about combating sarcopenia. So how we combat muscle loss is that we want to make sure that we get adequate protein in our diets and we want to do resistance exercise. Both are important. We need to make sure that we are working those muscles and getting enough protein. And I'll be diving a little bit deeper into how to get more protein, but these are very, very important. So again, as everyone watching this is understanding that sarcopenia is probably happening to you, depending on your age, make sure you work those muscles, make sure you get enough protein, and make sure that your clients do too, because it is so important in maintaining independence with aging. So let's talk about maintaining a healthy lifestyle. And we're looking at during hospitalization, rehabilitation, and post-discharge. So, some things happen, someone's in the hospital. Okay, they're not quite ready to go home yet. So they're getting rehab, they're getting that high level of care. And then we have post-discharge where they are home. And home can look like lots of places. That could look like home independently. That could look like home with family members. That could look like a retirement facility. That could look like assisted living. It could look like many different places, but that is home to someone. That is their home base where they go back to. So During a hospitalization, rehabilitation, and post-discharge, so in all the pieces, when it comes to nutrition, our concern is a couple of different things. So healing and preventing muscle loss. And I want to talk about healing and nutrition and calories for a minute, because when we are in the hospital, when we're in rehab, when something's happened to our body, regardless of what it is, our body's working real hard on the inside, using energy, using calories to heal itself, to get the body good so that way it can go home, right? So I like to give this analogy of what calories are to the body, thinking of a car. So if you want your car to move, you have to go to the gas station and put gas in it, right? Now we can go far with this analogy. You also have to maintain it. There's a lot of things you got to do to keep your car in tip-top shape. But we know for our car to move, we need to put gasoline in it. For our bodies to work, we need to put calories in it. Calories are what's found in food. There's different amounts of calories in different types of food, but our body uses calories like a car uses gas. So yes, we use calories when we work out. We also use them when we move around. And when someone's in the hospital, even if they're in a hospital bed, their bodies are working really hard on the inside to heal itself, and it's using calories. And there's certain situations, like maybe someone's in the hospital for burns, the body is working overtime to heal that. And so you're using even more calories. So we need to make sure that when someone is actively healing, they're getting the nutrition their body needs to heal their body. Because if we don't, they're going to start losing weight. The body's going to find nutrition somewhere. It's going to start pulling it from the muscles. It's going to start pulling those calories from other places in our body, which leads to that unintended weight loss and muscle loss. So we want to make sure that there are adequate calories for healing and nutrients, and then preventing that muscle loss. So looking specifically at hospitalization and rehab. So our nutrition concerns are that healing, because again, it takes, it takes energy to heal the body, which is calories, and we want to prevent muscle loss, especially in the situation where someone's not able to move around a lot because they are in a hospital bed. So some of the key points that we want to look at for maintaining a healthy lifestyle in hospitalization rehab is making sure someone's getting adequate snacks and meals. Skipping meals, they're skipping their snacks, they can't eat, then it's really important to talk to the interdisciplinary healthcare team to figure out why aren't they eating, and doing everything we can to make sure they are able to eat. And there might be something going on. It could be something from depression. It could be the issues with chewing and swallowing. There's a lot of different things that can be going on. So if we see someone who's not eating, we know they're not getting the nutrition, the calories, it's going to make it harder for their bodies to heal and get strong and go home. So we also want to make sure they're getting adequate protein because, again, protein is very important for muscles. So we want to make sure that there's a good protein source with every single meal throughout the day, including snacks. We know that our bodies can only process and absorb so much protein at once. So it's not a matter of I'm going to eat a ton of protein with dinner, but then none with breakfast, lunch. We need to make sure that we spread it throughout the day, including breakfast. Sometimes with breakfast, someone might just have some toast, butter, and coffee. That's not going to cut it. We want to make sure that they get a good protein source in there as well. Of course, adequate hydration for the body, and exercise as able. Work with the interdisciplinary healthcare team, because there's different priorities, right? If someone is very, very sick in the hospital, we're not going to want them to get up and exercise, because if they fall and get hurt, they're not going to be able to go home. But as they're able to do exercises, working with the healthcare team, that's going to be really ideal to help to maintain that muscle. So looking at post-discharge, what are our nutrition concerns for maintaining a healthy lifestyle once they're home? Because we want to keep them from coming back. Really high level is just staying healthy and, again, maintaining that muscle. Our key points are very similar to in the hospital. Eating balanced meals. Eating balanced meals throughout the day, getting adequate protein throughout the day, staying adequately hydrated, exercising as able, but then also maintaining weight. And maintaining weight, I think this is important for older adults. I recommend for most adults to maintain a healthy weight. That means no big gains, no big losses, and it's all related to muscle. I'm not diving into the research here. I don't have any slides for you guys on this, but we know, according to the research, body mass index, BMI guidelines are higher in older adults. So we know that a higher BMI in an older adult is associated with a lower risk of death. It's all related to muscle mass. It's all related to sarcopenia and all of that. But sometimes we see clients who maybe have a slightly higher BMI and they're told to lose weight. They lose weight, they lose muscle, while the whole goal is to improve health, it can actually be a health risk. So as a geriatric dietitian, I really encourage people to maintain weight, no big gains, no big losses. And if someone wants to gain weight or they have a medical indication to lose weight, maybe they have to get a knee replacement and they're told, oh, you need to lose weight before you qualify, then it's really important that they work with a registered dietitian to get the adequate nutrition they need to minimize muscle loss with weight loss. So that looks like making sure someone is there to help them get the protein they need throughout the day, get the calories that they need to meet their needs, but still help with, and also to do that resistance exercise. So breaking the cycle, we often see the cycle of readmissions, hospital, rehab, back home, hospital, rehab, back home. And how we can break that cycle is through the transformative power of food and nutrition. So we talked about maintaining a healthy lifestyle, looks like whole health. It looks like, all of these different things, but I want to focus in on the nutrition. And I want to talk high level nutrition, just some high level guidelines, and then diving specifically into the protein needs. So this is a wonderful tool. It's through Tufts University. You could always just Google My Plate for Older Adults. It'll pull up the website. They have some great resources. But My Plate for Older Adult is a really good guide on how to provide a healthy, balanced diet that provides all the good nutrition an aging adult needs. And essentially a balanced plate includes fruits, vegetables, protein, dairy, grains, fats, and fluid. So when we look at this plate, we see the left half is full of fruits and veggies. The right half has some good whole grains in it. It's got some protein sources, a little bit of dairy, some heart healthy fats in the middle, and of course, fluids, because hydration is so important. We already talked about those changing nutrition needs, how older adults need more protein, technically less fiber, but everyone needs more fiber. We need to make sure that we are getting enough vitamin B12, especially through fortified foods or supplements, because we need to, get half of our needs through a supplement or fortified foods. Vitamin B6, calcium, and vitamin D needs are increased, but I want to talk to you guys about protein because this one's related to muscle, among other things. And it's so important for older adults and keeping them home to age in place. So we know that protein is found in every cell of the body. It is important. It is involved in overall health, immunity, muscle, and physical function, and it promotes independence. Now, the recommended dietary allowance, these are the guidelines I keep telling you guys about. So technically, the guidelines for older adults are the same as for younger adults, but we're going to look at the research on why it's important that older adults get more. So according to the RDAs, any over age 19 needs 0.8 grams of protein per kilogram body weight. But we know, according to research, that older adults need more protein. In fact, older adults need 1 to 1.2 grams of protein per kilogram body weight. So quite a bit more than younger adults. And the reason they need more protein is because of all those changes we talked about in aging, the physiology of aging, sarcopenia. They need more protein to help protect those muscles. And of course, along with endurance and resistance exercise, we know that too little protein can cause malnutrition or muscle loss. Even if they get enough calories, if they're not getting enough protein, it can cause issues. So what foods have protein? Lots of foods have protein. That's the great thing. So oftentimes when we think of protein, we think of animal sources, but we're going to talk about plant sources in the next slide. So this is just showing some common food sources, what the serving size is, and how much protein is in each serving. So we know that beef is a really wonderful source of protein. Greek yogurt has more protein than regular yogurt. It's how they strain and make it. But there's other foods that still have a good amount of protein from, salmon, chicken, lentils, almonds, milk, and quinoa. Now, some people don't eat meat, and that's okay. If someone's a vegetarian, then they should just make sure that they're eating a wide variety of protein sources throughout the day. Now, some vegetarian sources, now eggs, if someone's vegan, we're not giving them eggs, but chickpeas, eggs, oatmeal, spinach, green peas, avocado, apricots, you could see, yeah, there's less protein in some of these, especially the avocado and apricots, but it all adds up. If you provide a meal, maybe it's like a spinach sandwich with some green peas and avocado, maybe some chickpeas on it. You combine that all together, well, gosh, it's getting up there in protein. So looking at some strategies on how to optimize protein intake at home, and this depends based on if someone has meals provided for them or if maybe they're making food, in their room or if they live independently. But if someone is shopping for foods on their own, then they need to make sure that they purchase foods naturally high in protein like meats, lentils, eggs. We just showed a bunch of ones on the last 2 slides. And also making sure that they're able to read labels for protein content. There's lots of food products that are high in protein and are great protein sources. So making sure they understand how to read a label, from how many servings are in this container, what's a serving size, where is the protein on my label. So some other strategies for meal preparation is making sure that high protein foods are provided at every meal throughout the day. Breakfast is a wonderful opportunity for protein. Oftentimes it is skipped, but it is a wonderful opportunity to throw in a little extra protein. Sure that we include beans, meats, lentils throughout the week as it fits into someone's dietary pattern. And then at the table, if someone's not getting enough protein, they could always have something like milk or that has protein. They can have high protein foods as snacks throughout the day. So we're getting a little bit close to the end of my talk, so I want to share a couple other strategies before we wrap things up. So nutrition is important for so many things, in addition to helping, prevent muscle loss, keeping someone at home, aging in place. But there's other things that we need to make sure we're looking at. Nutrition is really important when it comes to helping manage conditions like diabetes, heart disease, kidney disease, osteoporosis, etc. And we want to make sure that we are managing all health conditions. So yes, proper diet, but then also looking at medications, looking at that whole picture, making sure that someone is getting their healthcare needs met. So as we're at the end, I've talked about a lot of different things today. We started off talking about the changes of nutrition and health with aging. We shared that super busy slide with the physiology of aging, all those things that are going on inside the body, changing health needs, changing nutrition needs specific to older adults, because nutrition for older adults is different than nutrition for adults at the prime of their life. Then we talked briefly about some other issues. Then we talked about maintaining a healthy lifestyle when in the hospital, rehab, and when home. We talked about high level nutrition, but then specifically protein. And now we are wrapping things up. And my hope is now that we're at the end of this part of the presentation, that you're able to understand the changing nutrition needs with aging. You're able to recognize the benefits of maintaining a healthy lifestyle during hospitalization, rehabilitation, and post-discharge, and that you're able to describe how nutrition can be used to prevent future hospitalizations and health complications. If we can get them that good nutrition, get them that protein, protect those muscles, we can help keep them nourished at home, aging in place, enjoying their golden years. So we are now at a really fun section, because Chef Sonia is going to share some recipes, some really wonderful recipes, where she's going to show tangibly how to more protein. So I'm going to go ahead and hand it off to Chef.
Hi, everybody. Today we're going to make a recipe that features protein as one of its nutritional benefits. We're going to make tuna cakes, or as my mom says, salmon patties with tuna. So we're going to start with our wet ingredients and our spices. So first we have some yogurt. We have eggs, and we have our spices, and we're just going to empty them into the bowl. We'll give them a quick stir. Okay, then we're going to use canned drained tuna. Okay, or you can use salmon. Okay, we're just going to give that a bit of a stir to get the tuna wet. Okay, then I'm just going to show you something really quick. We're actually going to use ground cereal. Okay, if you don't have like a Roku or food processor, you can actually put the cereal in the bag, kind of like you do for graham cracker crumbs. Use a can or a bottle, scrunch it that way, and that's an easy way that you can go ahead and get your crumbs in. We're going to add our cereal crumbs. These are gluten-free, by the way, so feel free if you want to use breadcrumbs. Yes, you can. We're just trying to use things that we have available in our kitchen. For aromatics, we added some diced onion, a bit of a stir. Okay, and then real quick, for moisture, we're also going to chop up some fresh spinach. Just kind of give it a nudge, kind of like you would parsley. This is going to add some extra moisture to our tuna cakes. Doesn't have to be super fine. Just enough where you don't get great big pieces of spinach in your teeth. If you wanted to use frozen spinach, you can too. Just make sure that you press it out so it's not wet. Okay, and then we can go ahead and we can put it in our bowl. Okay, bring this back in sight. If you want to, you can also spice it up a little bit. You can add some ground chilies, or if you just want some color contrast, we have some diced pimentos. And this is going to kind of look like cookie dough. Not too wet, should not be dry, Should be just enough where it comes together. Okay. And at this point, we're actually going to do a number 8 scoop, which is our 1/2 cup serving. I'm going to bring that in line for you. Okay. Press, make sure you get an even portion. Okay, and at this point, you can patty as you go onto the tray, or you can go ahead and put all of your scoops on the tray and then just press them down afterwards. Both of those are fine. Next, this part is really great. You can put them in the freezer and save them for later. So this way, prepping for a rainy day, prep ahead, all of that is fine. If you're ready and you want to go ahead and bake them now, that you can go ahead, pop them in the oven. It's 300 for a convection oven or 350 for a standard oven. Just baking till brown. And so here you can see the coloration. You can see all that beautiful spinach popping through there. The recipe doesn't call for condiments or tartar sauce because you don't really need it. The spinach keeps them super moist. Here, though, I just put some garlic chili sauce on the sides just to have a little bit of something if you want to get zippy, kind of like hot sauce for fish. But up here to give you a more full, complete presentation, I did mandarin almond salad with some mixed greens and then just some steamed veggies on the side. So delicious, yummy. Hope you enjoy. Hi, this is a protein recipe. It's called Southwest Steak, and it features a brown rice and black beans with grilled steak. One of the things in the recipe is actually for crisps. And the cool part is you can use any of your baked goods that you already have on time. We're using day olds at this point, and so for this, we're actually just going to slice them on the horizontal and bake them off. So here we have a jalapeno cheddar scone. We have some garlic cheddar biscuits, some plain biscuits, and these are the same things, just smaller. So whatever you have is just fine. We're going to slice them horizontally, okay, put them on a sheet pan. For the ones that have the cheddar and the jalapeno, you don't need to put anything else, just dry them out, so bake till crisp. Okay, for these, if you want to have a little bit more flavor, you can spray them with pan spray first, and then go ahead and put dry spices on. But that's up to you. They're delicious either way. Don't need it. So let's move those aside. We're going to move on to our next part. This part, we're actually going to do, the recipe calls for mixing the rice and beans together to kind of make like a Buddha bowl concept. So we're going to demo that as written, and then we'll show you some different ways that you can alter your plate up later on. In this next part, is seriously, it's dump and go. Okay, we're going to add all of our ingredients. All right. Okay, and just that easy, our rice salad is done. At this point, you can go ahead and you can either steam it, you can refrigerate it. If you're going to serve it cold, you can add some additional moisture. You can add the chimichurri sauce or a vinaigrette of your choice, but it's delicious this way because of all of the other flavors. Here you can see the grilled steak. Use whatever you have, okay? Whatever protein you have is fine. You're going to see we're going to have some other alternatives in a second. The chimichurri sauce, this is a great way to use up your fresh herbs. Here it's the cilantro and the parsley, but use what you have. The oven roasted tomatoes, they're roasted dry. Okay, so that way it was just enough to burst them. Then it gives us a way that we can then freeze them, refrigerate them, use them later. So it's, again, it's saving your inventory. Here, just a pop of color, you know, especially if you were doing summer flavors. Some roasted corn, some mixed peppers, all of those are wonderful together. So all of these are wonderful flavors. Let's go ahead and review some different plate up options that we had. So here we actually have the rice salad. We did the aromatics mixed together, and then I kept my beans separate, layered my steak on top, put the chimichurri and then the roasted tomatoes, and this you can see the jalapeno cheddar crisp. In this next one, you can see I actually have the rice salad in the middle again. I topped it with the chimichurri sauce and the roasted tomato. Wonderful combination. There I added like a 3-bean salad. So that one does have the vinaigrette on it, does have the onions and celery in it. Just pairs really well. And then I added a grilled tofu, and here are our biscuit crisps. In the one that we have down front right now, okay, the cubes, that's actually paneer cheese. That one, we seared it off and we tossed it in our chimichurri sauce and then added our roasted tomatoes and our beans with it. That's a wonderful combination, pesto and cheese. The chimi is just wonderful. Okay, and in this last set, you can see this is where we have the Buddha bowl that's closest to the recipe image that you see. That one we have the rice, we have the beans. We did layer the chimichurri sauce in there and the roasted tomatoes, just delicious. I really hope you enjoy this recipe, and I want you to feel encouraged. You can do this for season and go ahead and use whatever ingredients you have in house. On this particular recipe, we're actually going to combine protein from yogurt and protein from chicken. And so the cool part about this is that we're actually going to use the yogurt as a marinade for our chicken. So we're going to mix those 3 ingredients together. Really easy, set it and forget it. If you're going to use frozen chicken, you need to make sure that it's thawed first, but it's easier to sometimes get all consistent size on your chicken fillets that way. If you're going to use capon or fresh chicken, you definitely want to weigh them and make sure that you're scaling, but you can also use this for chicken kebabs, and then you can bake them in the oven. So really whatever size chicken you have is fine, but the marinade holds up well to both baking and to grilling. So we're going to go ahead and we're going to mix our ingredients together. This one is lemon juice and olive oil. And then we have our yogurt and our seasonings. And so we're just going to blend these together. You can whisk it or stir it, but just that easy. Okay, we have our marinade for our chicken. Now at this point, put your chicken in, stir it around, put a cover on your container, put it in the refrigerator. At least 2 hours, but you can do it overnight, it's just fine. So we'll set that aside. And now we're going to go ahead and mix a tzatziki sauce using the same yogurt. Okay, so in this one, we're just using cut slaw. You can cut your own or buy a prepared mix. Our aromatics are cucumbers, onions, dill. Okay, and then our moist ingredients, we're going to use lemon juice. We're going to use more yogurt. And then we're going to season with just a little bit of cumin and black pepper. I'm actually trying to cut out some of the sodium in these recipes, and so you really don't need it. Okay, I mean, it's seasoned to taste, but you really don't need it. You can use your favorite no salt blend if you need a flavor booster for any reason. Now you're going to notice this is kind of thick up front, but you know that slaw or cabbage will actually start to break down. And so sometimes it gets wet upon standing. And so it's going to be perfect. You can mix ahead so you can eat it right now. But it's going to be better if you let it rest for like 2 hours, or if you make it the day before, or even the morning of for the next shift is fine. Okay, but that simple, we have our slaw done also. So with those components, I want to go ahead and show you how we did our build. So in the recipe, it actually calls for a 6-ounce chicken breast. It's hard for me to find that large size, and so we actually got fresh capon and then we cut it down. But you'll see it's also thicker. So what we did was we still started it on the grill, but then we finished them in the oven to make sure that they were all cooked the same way and they were all safe to eat. So here we put it on our bun as expect. Then we served our lettuce, tomato, and onion on the side. Here we served our tzatziki salads, our tzatziki slaw on the side, just because it was so wonderful. I want to use that as a side dish. And then just to get a little bit more volume on the plate, I added a tomato cucumber salad. Just all of our flavors feel very Mediterranean. As we go down to our front plate, you can see that I exchanged the bun and added spinach instead. And in this one, I actually sliced the chicken. And I'm not sure if you can tell just from looking at it, but this one's only 3 ounces of chicken instead of 6. But because we sliced it, we still have plenty of plate coverage. So especially as you're looking at, different size portions for your appetites, this is a great way that you still get plenty of coverage, plenty of plate appeal, but you don't necessarily have to go with that large portion if people aren't going to eat it. Here, same thing. We included some fresh seasonal vegetables. We had our cucumber, our peppers, and again, we added our tomato salad. So I really hope you enjoy. This is kind of like a nice play Mediterranean vibe. Lots of fresh flavors. You can use it season round. Definitely one of those that you can prep ahead. I really hope you enjoy the tzatziki salad.
Thank you so much, Chef Sonia and Katie. And we do have some questions, so we're going to go ahead and move to that portion of the presentation. This first question comes to us for Katie. And Katie, do we use actual body weight or ideal body weight when calculating protein needs?
So I tend to use actual body weight, and I only use it as long as I adjust it for higher BMI guidelines in older adults. And so I know that's probably a lot for me to throw out there, especially if you're not familiar with what those terms mean. But because we know that older adults with higher BMIs have a lower rate of mortality, I tend to focus, if I'm doing an ideal body weight, then I make sure that it equates to a BMI that's a little bit higher, and then I'll adjust from there. So in a lot of cases, I do use actual body weight, but lots of caveats in there.
Perfect, thank you. And I believe this next one is for you as well, Katie. Can you please share which reference lists lower fiber needs for older adults? Specific amount by age would be helpful.
Sure. I am going to so the recommendations for older adults is coming from the RDAs, the recommended dietary allowance. So looking specifically at fiber, I've got a little article pulled up here on my website that really breaks it down. So we know that the RDA for men greater than age 51 is 30 grams per day, and the RDA for women ages 51 and older is 21 grams per day. So it's a little bit lower than like the 25 that we might see in younger adults. But again, 95% of people don't get the fiber needs that they need. So, that's not even usually something I share with most older adults. It's more just on the back end as providers to understand that the national guidelines are lower.
Perfect. Thank you, Katie. And we're going to move over to Chef Sonia. Chef Sonia, Katie actually also talked about protein sources that maybe weren't meat-based if people have an aversion or they don't eat meat. Can you please talk about some of your favorite protein sources that may not come from a meat source?
Well, I think the paneer and the tempeh and tofu are all wonderful choices. And beans, you cannot, underrate the value of beans as beans and legumes as a protein source. There's just so many flavors and textures that you can get in there. And I just really encourage you to go ahead and play with those. Yeah.
Perfect. Thank you so much. And I think that's all the time that we have for questions today. So we're going to go ahead and move to closing. And again, I do really appreciate Chef Sonia and Katie being here today. I do want to say thank you again for your time. All of you will be receiving an email in the coming days that will include links to the slides presented today, as well as the continuing education certificates. Please be sure to check your spam folder if you don't see those. Additionally, please make sure to visit generalmillscf.com for information on rebates, helpful marketing tools, videos, and new item launches. And finally, don't forget to connect with us and the Bell Institute of Health on our website and socials. This will conclude today's program. You may now disconnect. Thank you so much for joining us today.